think we have to expand our thinking about how we're managing erectile dysfunction. It's not just a matter of take that man who's significantly dysfunctional and here's a pill. Mm-hmm. Rather, we need to think more broadly about who's at risk, think about ideas for trying to establish his risk profile, mm-hmm. maybe suggest early lifestyle modifications. Well, erectile function recovery means that when there is some sort of injury or insult, it's something we know is going to happen, like a radical prostatectomy or any kind of pelvic surgery. How can we help that person get back to a level of how they were performing with their erections and being able to perform sexually as they knew prior to the surgery? That is what we might mean by erectile function recovery. At the same time, it could apply to other disease states like diabetes mm-hmm. or vascular diseases, that when somebody finds that they're having function that deteriorates.
As a last question, statins and erythropoietin could be those novel agents to put in a cocktail with PDE5 inhibitors?
I think so. So an idea might be in the patient who has a radical prostatectomy, but maybe even the patient who just comes in the door has erectile dysfunction. After we try to optimize things, okay, tell them, do the right risk modification behavior, discontinue cigarette smoking, get a little better health, all these kinds of things. But on top of that now, the suggestion that he might want to get on statin therapy, PDE5 inhibitor therapy, maybe even erythropoietin, maybe even, as I suggested, a long-term angiotensin receptor blocker like losartan. And all these things taken together may work on the smooth muscle, the endothelium, the nerve tissue, all these things.